Good evening, and thank you for joining us for this week's Community Leader Call. My name is Tomas Talamonte, Deputy Chief of Staff to Mayor Muriel Bowser. I want to thank you for joining us this week and every week, join us for this week and all of our Community Leader Calls that we've had throughout the duration of the public health emergency. Again, we will be covering the district's response and recovery efforts related to the pandemic. Before we get into the program, I do want to remind everyone for the most up-to-date information and resources, you can visit coronavirus.dc.gov. Again, that website is coronavirus.dc.gov. In a short moment, we're going to open the lines for a Q&A portion of the program, so you can press 0 now to be entered into the question queue if you have any questions. We will also be taking questions from the live streams on Twitter and Facebook. So if you're watching on either of those platforms, you can also ask your questions directly there to begin and then we'll get to those questions during the question and answer part of the program. This evening, we'll be joined by Dr. Shaw, who is the Principal Senior Deputy Director at DC Health, who will provide an update on where we're at with everyone's mind, the vaccination plan here in the district. And then we will also have a representative from Homeland Security and Emergency Management Agency to answer questions, other questions you may have on, which is we're joined by Director Christopher Rodriguez, who is the director of our Homeland Security and Emergency Management Agency. So before we go into the Q&A portion, I do want to allow opportunity for Dr. Shaw to provide an update on where we're at with the vaccination distribution in the district, and then we will go into a question and answer portion of the program. So, Dr. Shaw?
Thank you, and thank you all for having me. On March 7th, the District of Columbia had its first case of COVID-19. And since then, I think all of us will agree that our livelihood of not only ourselves, our families, our loved ones, our community has been upended. It's been absolutely horrible, to be frank with you. I am incredibly excited to talk about the light at the end of the tunnel, which is this new COVID-19 vaccine. The development of this vaccine, and I'm specifically talking about the Pfizer BioNTech vaccine that has just came out and came into the district, is a remarkable achievement of science. We have made this vaccine quickly, not by changing anything of what the scientists do. I always say it's not actually the folks in lab coats that changed their process. It was the folks in suits that changed their process. What that means is it's really the coordination between the federal government and the pharmaceutical company and the studies all were done very tightly, so we were able to move from one step to another fairly quickly. Also, the FDA has an independent body reviewed the data of this vaccine and determined safety. But then after that, after the FDA completed its emergency use authorization, the CDC Advisory Committee for Immunization Practices, a group of independent scientists, looked at the data and gave a recommendation for the vaccine. This vaccine is a 2-dose vaccine that you take about 21 days apart, and it is approved for those individuals above 16 years of age. There are 2 contraindications to the vaccine, so reasons why someone should not take the vaccine. One is if you had a severe allergic reaction to this vaccine. So it's really thinking about those in the second dose. And number 2 is if you've had a severe allergic reaction to a component in the vaccine as well. The district started receiving its first doses of vaccine on Monday. GW Hospital and Howard University Hospital received the vaccine on Monday. MedStar Washington Hospital Center, Georgetown University Hospital, and Children's National Hospital received it on Tuesday. and Kaiser, Capitol Hill received on Wednesday. Kaiser's partnering with our fire EMS providers, as well as some of our frontline public health workers, to vaccinate them. We know there is a limited supply of vaccine, so there's a framework on the priority list for who should have access first. That's available. Our plan is available at coronavirus.dc.gov/vaccine, but also the CDC has talked about it. And essentially, with the first phase, you might hear phase 1A. What that means is healthcare workers and those who have who live in long-term care scenarios. DC, that phase 1A workforce is over 85,000 individuals, because we are talking about folks who work in DC, irregardless of where they live. We know about 75% of our healthcare workforce lives outside of DC. It is absolutely unfortunate that the federal government decided not to allocate our doses based on our workforce for our population. So the district ended up getting a very, very small amount of doses in the beginning. However, as you might have heard today, for our next couple shipments, Maryland and Virginia decided to partner and move some of their doses to the district for the next coming weeks, which is an incredible partnership from Maryland and Virginia when our federal colleagues weren't able to meet the need of the district as well. The Pfizer vaccine requires something called ultra cold storage, so negative 70-degree freezers, and that is why we're really leveraging the places that have that, our acute care hospitals. But the Moderna vaccine, which will likely be getting authorization this weekend, does not require that and can be moved a little bit further, moved around a little bit more. In terms of next steps, we're working through our acute care hospital system, our fire EMS, our frontline public health workers. We are, quote unquote, turning on the long-term care partnership with CVS, Walgreens, and Walmart, in which they go to skilled nursing facilities and assisted living facilities to vaccinate their staff as well as their residents. We are currently working, and we're going to currently develop different access points for other healthcare workers that are in phase 1A to be vaccinated. If that line item isn't in phase 1A, we are still talking about workers in healthcare settings. One last point to make for phase 1A, we are not talking about roles for the provider. So we're not talking about the doctor gets it, but someone else doesn't. It's anyone who works in that setting, from environmental services to dietary services to the physician as well. They're all treated equally as well. So I look forward to communicating and talking to you a little bit more, answering some of your questions about how this plan will roll out. After phase 1A, just to mention, phase 1B is essential workers. So those who had to show up to work during the mayor's stay-at-home order is a nice way to think about it, plus those who are higher risk for poor outcomes from COVID-19, namely seniors and those with chronic conditions. Then phase 2, we're moving on to the general public as well.
Thank you, Dr.
And
Shaw.
I will pause there and happy to answer questions. Thank you.
Definitely. Thank you, Dr. Shaw. We appreciate that very thorough overview. And we will now move into the Q&A portion of the program. So again, I want to remind everyone, if you have any questions related to not only the vaccination plan here in the district, which Dr. Shaw can answer your questions. Again, we also have Director Rodriguez on the line for any questions just related to the district's response and recovery efforts on COVID-19. I do want to draw attention again to everyone before we go into question and answer. You can press 0 now to be entered into the question queue or ask your questions directly on our Facebook or Twitter social media accounts where the live stream is occurring. I also want to draw attention, last night the mayor signed an additional mayor's order clarifying capacity limits at several essential, non-essential business, retail, and other businesses. So if you would, that is available. That mayor's order is at coronavirus.dc.gov/phase2. So we do urge residents to go not only familiarize yourself with the most recent mayor's order, but all of our mayor's orders that have been signed are available there, as well as all of our public health guidances for the various industries. So please make sure you visit there. So we'll start now with the Q&A. Again, press 0 to be entered into the question queue if you're joining us by phone. The first question we're going to go to is from Robert Werner in Ward 3. Robert, your line is unmuted.
Yes, hello, and thank you for taking our questions. Can you hear me?
Yep, we can hear you.
Oh, great. What would be the time frame for someone in Group 1B who's a senior citizen with health conditions? When could they expect to receive the vaccine, and which vaccine is it likely to be?
Thank you for your question. And we get this often. There's nothing more I would like to do than to give a concrete time frame of when 1A will conclude, 1B will start, and phase 2 will begin. That is a product of our allocation from the federal government. And as of today, we are still confirming our doses for next week. So the district does not have insight into the cadence or the amount of doses we will get to help us determine at what time period phase 1A will phase out, so to speak, and phase 1B will start, and whether those cadences of doses or the allocations of doses will change from now compared to later in January or February as well. Nationally, the idea is really phase 1A, the healthcare workers, possibly through January. And then at the end of January, you move to phase 1B. And you really don't get to the general public until later in the spring. Phase 1B in the District of Columbia is over 300,000 people, because that includes our essential services, or individuals with higher risk conditions, but also we are tasked to vaccinate the federal workforce who are essential workers in the district as well.
Thank you, Dr. Shaw. We're going to go to our next question. Again, we want to remind everyone before before we go to the next question that you can press 0 now to be entered into the question queue. We're going to take our next question from Dana Fitzsimmons. Dana, your line is unmuted.
Good evening, and thanks for taking my question. I appreciate it. Are you able to hear me?
Yep, we can hear you.
Okay. I'm a recently retired pharmacist in Ward 2, and I also have a master's degree in public health, and I'm taking advantage of the district's Department of Health offering of becoming a vaccinator here in the district. So my question for you is, I've been reading about the D.C. Medical Reserve Corps, and I'd like to know what kind of a role the Medical Reserve Corps might play in the vaccination campaign.
That is a fantastic question. The Medical Reserve Corps has been an incredible resource to the district throughout this pandemic and our pandemic response, from flexing up our care operations and our testing capacity. And we do think there could be a role during a massive vaccination effort. And I would like to refer to my comments before. It really just depends on the cadence of vaccine we receive and the ability for our health system to manage that, or if the district government or other resources are needed to ensure high access to vaccine. Our goal is that any category, if you're in any category and it is you're up to have access to the vaccine, it is easy for you to have access to a vaccine. It's a simple process, and there's multiple points of access for you to receive that vaccine. So to directly answer your question, there could be a role, and that's something that we'll likely think about in the next coming weeks.
Thank you, Dr. Shaw. We're going to go to our next question. And again, before we go on to our next question, I want to remind everyone to press 0 now. Our next question is going to come from Chris in Ward 3. Chris, your line is unmuted. Chris in Ward 3, your line is unmuted. All right, we'll go to our next question, as we're not hearing Chris. The next question is from Claudia Lewis in Ward 6. Claudia, your line is unmuted.
Hi, thank you so much for taking my question. I understand that the public health emergency is scheduled to expire at the end of the year, and I was just wondering if you think it'll be extended.
Thank you, Claudia. We'll go to Director Rodriguez for a response on that one.
Yes, thank you for the question, Claudia. Yes, we do anticipate that the public health emergency will be extended past December 31st. Right now, we are determining how long that extension will be. So when we do make that recommendation to the mayor and the mayor decides how long it'll be, we will certainly let folks know. So yes, it will be extended.
Great. Thank you, Director Rodriguez. Again, I want to remind everyone to press 0 now to be entered into the question queue if you have not been able to get your question answered. The next person we're going to go with is Lewis Davis in Ward 4. Lewis, your line is unmuted.
Thank you so much. Lewis Davis here, Director of AARP, District of Columbia. I had a question about, are there any guidelines available online or elsewhere for how the district will acquire and confirm consent for persons with limited cognitive abilities before they receive the COVID-19 vaccination, particularly persons in nursing homes and assisted living facilities?
Thank you for your question, because that is something that is very important. I think the best information currently I would direct to the Centers for Disease Control COVID-19 vaccination page, in which they have information around the long-term care pharmacy partnership, as well as information around consent and assent for those individuals.
Thank you, Dr. Shaw. We're going to go next to our next question, which is Charles Hedman in Ward 6. Charles, your line is unmuted.
Great. Yeah, thank you for taking the question. I just wanted to know if there is a petition process available or anything like that for healthcare workers with severe underlying conditions to perhaps move to the front of the line for the vaccine receipt. Just seeing if there's any sort of petition process or anything along those lines for those who are already healthcare workers and also have severe underlying conditions.
That is a great question. And if you look at our COVID-19 vaccination plan, we did have considerations around sub-prioritization around phase 1A. It's in our appendix of our plan, in which we engage our scientific advisory committee, which is an independent committee of scientists and community leaders in the District of Columbia, as well as the Kennedy Institute of Bioethics at Georgetown, to determine if, since we're getting a little amount of vaccine, how do we prioritize phase 1A individuals? And we did think about considering the risk of the individual of having poor sequelae of COVID-19. From the logistical and practical matter of how that would work is each facility who's vaccinating their own staff has we have recommendations around priority. So if you were part of a larger institution, that institution could factor that into the prioritization of the vaccine. However, for the purposes of the healthcare workforce writ large and access to it, it would really be based on that as opposed to the risk profile. That being said, we are talking hopefully in a matter of a short period of time to really vaccinate the rest of the healthcare workforce as well. So it is not as though there is going to be a long, drawn-out process for it. We are really aiming to have enough vaccine and to use our partners to ensure those with healthcare workers with high-risk conditions and those healthcare workers not with high-risk conditions have similar ease of access to the vaccine in the coming weeks.
Thank you, Dr. Shaw. We're going to take some questions from our viewers watching on our live streams on Twitter and Facebook. Before I do, we are getting close to 10 minutes until our call ends for this evening. So I want to remind everyone, if you're on the phone and you want to ask a question, you can press 0 now, or you can ask your question on our live stream on Facebook or Twitter. The first question from Facebook is from Layla. The question is, if the vaccine is several doses, what occurs if you do not get all doses prescribed with the vaccine?
That is a great question. So the studies are done on a 2-dose, people completing the full 2 doses, which show for Pfizer over 95% effectiveness, which is incredible for a vaccine. If you have one dose, I think it's reasonable to assume you have some protection, not the full 95%. There's no way we could kind of put a number to that. There is no other harmful side effects if you don't get the second dose. You just don't get the full protection that's studied. And we just don't know what that protection is after just one dose.
Great. Thank you, Dr. Shaw. Our next question from Facebook is from Angela McKinney, asking if the vaccine will be free for those uninsured, or and once we move into the phase of more of the public receiving the vaccine.
Yes, the vaccine is free for anyone who wants the vaccine. The District of Columbia is lucky to have the second lowest uninsurance rate in the nation and incredibly strong access to primary care across all 8 wards, with a strong federally qualified health center network as well. And for the providers who are administering the vaccine, they still can bill for the administration fee, and either the public insurance or private insurance will cover the full cost of that with zero cost to the individual receiving the vaccine.
Great. Thank you, Dr. Shaw. We're going to go next to our next question is going to be from Jacqueline Mears in Ward 2. Jacqueline, your line is unmuted.
Thank you. I have 2 questions. One is, when does the vaccinations get to doctors' offices? And the other one is are there age categories that have a preference? What is the hierarchy?
So for your first question, when do doctors' offices get the vaccine? It will be in phase 1A, so that will likely be in the coming weeks. However, to actually receive the vaccine and administer the vaccine, there's a process that a physician's office has to take. So again, if you go to coronavirus.dc.gov/vaccine, the first step of that is enrolling as a pandemic provider, and then the district has to ensure that you have the appropriate storage and handling capabilities, the appropriate staff and supplies, as well as the ability to report through our immunization information system to DC Health and CDC. I recommend, if you are a smaller practice who's really thinking about your own healthcare workforce as opposed to providing access to the general public or high priority groups, there will be other ways for your staff to get vaccinated as opposed to you receiving vaccine and vaccinating your staff. As I mentioned, it's a multi-step process to be a vaccinator. And if you are a smaller practice, it might be better to utilize these other access points for your staff. However, we do want, if you are a pandemic provider, we do want as many access points for those individuals who go to your clinic to get vaccine. So if that is your plan, you want to be an open access point for the general public or for high priority groups, we highly recommend it. The more access points, the better for district residents.
Thank you, Dr.
And your second question around high priority, those above 65 are considered in phase 1B and would be have that high priority for access to the vaccine.
Great. Thank you, Dr. Shaw. And then next question is coming online. Just we had a recent snow. Is there a way for people to volunteer to assist during snow days? That's a fabulous question. I do want to remind everyone, I'm going to take this opportunity to remind everyone about Serve DC's DC Volunteer Snow Team, which you can sign up today to for hopefully future upcoming snowstorms. I love a good snow day, so I'm hoping we get some more snow this year. But you can sign up now to help shovel for a neighbor in need at snowteam.dc.gov. Again, that's snowteam.dc.gov. And you can sign up there today and become part of the DC Snow Team and be a snow hero for your neighbors. So again, we have time for just one more question. So we're going to go to Chris in Ward 3. Chris Kearns, I think you're back if we can hear you.
Yes. Can you hear me all right now?
Yes, we can hear you now.
Oh, thank you so much. I was cut off a little bit earlier. I want to know how and possibly when, also if you could predict, essential workers, that is, I think they're going to be phase 1B essential workers, critical infrastructure workers, will be provided the vaccine.
Thank you for your question. Again, that's going to be directly dependent on the amount of doses we receive from the federal government and the cadence of those doses. I do want to mention phase 1B is quite large, and just as we did with phase 1A, we might have to sub-prioritize within that phase. In phase 1A, we did that with our emergency departments and our ICUs, for example. So for phase 1B, we may have to sub-prioritize that group and think about the public safety or very critical infrastructure workers as well versus compared to some other federal essential workers. So with that all being said, the national plan is possibly around February for phase 1B. The District of Columbia will be dependent on the doses and the cadence of the doses from the federal government.
Great. Thank you so much, Dr. Shaw. I do want to thank Dr. Rodriguez as well from HCMA for joining us this evening. Before we go, I do want to remind everyone again for all of our information related to the district's vaccine plan. You can go to coronavirus.dc.gov/vaccine. We have the full plan there as well as an executive summary for you to review and familiarize yourself with that. Again, we will be back here not next week, but the week after. So we want to thank you all so much for joining us this evening. You can visit coronavirus.dc.gov for all of the most up-to-date information and resources. And as always, just want to thank you all and be safe. Thank you.